My name is Gemma Grandison and I will be your supporting host for today. I'm a presenter, host, I'm a mum myself, and I'm a huge advocate for mental health in general, particularly mothers' mental health and also Black men's mental health. That's dear to my heart. And I'll be looking after you today. I will be the supporting host and I'll also be coming in and out of the crowd with the microphone. There will be a chance for a Q&A after each and every panel, so don't be shy. Raise your hand, give me a little wave. I don't bite. I love a chat and give great hugs. So if you need any of those, they are on tap today as well. It may get emotional. We just don't know what's going to happen. Okay, so I would also like to take a moment to acknowledge and express our gratitude to our sponsors and partners for today who have made this conference possible. And the babies in the room, yes, we know you are here. We love you too. Give it up for the babies. We're doing it for you guys and your future. I love your energy, guys. This is amazing. This is what we love. Okay, so back to our sponsors and partners. So first of all, Lee Day is our headline sponsor for the third year in a row. So thank you, guys. We love that. Specialising in medical negligence to help those who have been injured by substandard care, ensuring women and their families are supported. And also, before I get into the sponsors as well, actually, we need a root situation for this. So we also have a few amazing hampers to give away today. Can I get a root for that? Yes, there are some great goodies in there, and they include items such as a cream set from Palmer's, products from The Good Hair, John Lewis luxury set, we all love a bit of John Lewis, baby accessories, toys, and so much more. And to enter, all you need to do, there's two things you need to do. You can't do one, you have to do both. The first one is to download the Black Mums app, so that is number one. And also you need to complete the conference survey to receive 2 tickets. So those are your 2 entries. If you want to go a step further and increase your chances, you can earn more by leaving a review on the app and also by posting any content today about today's conference on your socials, but make sure you tag the Motherhood Group. And once you've done any or all of those things, you can head over to the Motherhood Group upstairs, the table on the Black Mums app table, and show that you've completed these steps, and then the winner will be announced at the end of the day. So make sure you get entering. I think I'm going to enter that myself if I'm allowed, because I've already seen the goodie bag and it looks really good. Okay, so back to our sponsors. So of course we've had the headline one, Lee Day. We also need to mention everybody else. So we've got Tommy's, who is the largest UK pregnancy and baby loss charity, funding research in stillbirth, premature birth and miscarriage, with specialising in services for Black and Black mixed heritage women. Thank you, Tommy's. Then we have SANS, supports women and their families through baby loss. SANS raises awareness of the baby loss within the Black community and provides in-person, telephone and group sessions for support in those situations. We also have NCT, who advocates for parents through pregnancy, birth and early parenting courses, peer support and infant feeding helpline. We also have the Royal College of Midwives, UK's professional body and union for midwives and maternity support workers, providing guidance, development, resources and representation. We also have Pandas Foundation, supports individuals, their families and carers suffering pre and postnatal mental illnesses via their helplines, email, online community and support groups also. Then we have Kamal, who is a globally recognised leader in healthcare manufacturing, specialising in innovative procedure packs and vascular access devices. And finally, we have Erwin and Mitchell, who provides legal and financial advice to both individuals, businesses across various sectors, with particular focus on personal injury, medical negligence and family law. Okay, and we are incredibly grateful to have the support and phenomenal sponsors and partners who share our unwavering commitment to empowering and uplifting mothers throughout their journey and the whole cause of what we're here for today. So can we give it up for our sponsors and partners, everybody? Okay, so now that all that's covered, we've had the fire alarm. So if another one goes off, that's a real one, okay? Because that was the practice one. But yeah, we've got lots to cover today, so let's get on with it. So now it's time for us to welcome our main host for today. Are we ready for our host, the lady of the moment? Okay, so this lady is a trailblazing thought leader in Black maternal health, a TEDx speaker and Femtech founder, revolutionizing support for Black mothers through innovative digital solutions and community-driven initiatives. She's the founder of Black Mums, the groundbreaking digital app using AI to connect Black mothers based on lived experience, creating the ultimate networking experience for Black mums. Her ability to build trust serves as a vital bridge between Black mothers, families, and the healthcare system in general. There's more, guys, buckle up. As the co-founder of the National Inquiry into Racial Injustice in Maternity Care and author of the best-selling book, My Black Motherhood, Mental Health Stigma, Racism and the System, her work challenges healthcare professionals to listen to Black mothers' experiences. A spokesperson for Black maternal health issues on CNN, ITV, BBC, Channel 4 and Sky, and I'm sure there's going to be more to come. You haven't heard the latest of her yet. She has delivered speeches at the House of Lords and partnered with Meta, Dove, Nike Women and UBS. Through her organisation, she delivers CPD accredited culturally competency Black maternal health training and spearheads Black maternal health mental health week in the UK. She leads commissioned work engaging with thousands of Black mothers across the UK, building trust between Black mothers and the wider system. And let's not forget her accolades. They include her being named one of UK Vogue and Forbes Influential Women of the Year, National Lottery UK Game Changer for Community Leadership, Channel 4 on Lloyd's Black in Business finalist, Every Woman Social Entrepreneur of the Year, Santander Social Entrepreneur of the Year at the Precious Awards, and she was recognised by the Mayor of London as leader in Black maternal health. Her portrait featured floating, I don't know if you saw it, on St James's Park Lake recently, recognising her leadership for Black mothers across the UK. Ladies and gentlemen, please welcome the founder of Motherhood Group and founder of the Black Maternal Health Conference UK, Mrs. Sandra Igwe.
Wow. That was an introduction. Thank you so much, Gemma. Thank you all so very much for being here today. I am absolutely amazed to see so many beautiful faces in this audience. I've seen people from York, Bristol, Nottingham. Someone flew in from America. No, 2 Americans here that flew in yesterday. Like, this is incredible. Like, please clap for yourselves. And even though I'm smiling right now, because I'm just taking this all in, but my face wasn't smiling 9 years ago when I was in that hospital room feeling completely failed by a system that I believe wasn't built to hear me, to see me, to understand me. 9 years ago, I was labeled the angry Black woman, feeling completely failed by the system. When I questioned my treatment, my pain was mistaken for aggression. 9 years ago, I was expected to be that strong Black woman. When I questioned my treatment, when I asked for pain relief and was denied pain relief, even though I begged and pleaded for hours upon hours upon hours. 9 years ago, when I finally spoke up for myself, I became the difficult patient in their notes and in their quiet whispers. My symptoms were dismissed, they were ignored. I was told that I was exaggerating my pain. My daughter became extremely ill. I raised concerns, they were also dismissed. The trust finally admitted to a breach of duty, to negligence, and failure to recognize my daughter's failure to thrive. They acknowledged ignoring my repeated concerns, and there were concerns that could have been preventable had they actually listened to me. Now, although my daughter, when she turns 18, will receive a compensation, I still believe that justice still seems flawed. I felt at the time like another statistic, my child, another number. And we all should by now hopefully know the data surrounding black women. Black women are more likely to experience postnatal hemorrhage, preeclampsia, maternal sepsis, miscarriages, neonatal deaths, perinatal mental health challenges. But behind all of these numbers, these stats, this data, are real lives, are real people with real voices, real experiences, and real stories. And this is exactly why I set up the Motherhood Group, that time. So I'm just going to ask you a few questions. Who here believes that the UK is one of the safest countries in the world to give birth? Raise your hand if you believe that. No hands? Okay. Oh. Only saw 2 hands by the politician and Councillor Evelyn Okoto. But actually, they are right. They are right. That it is supposed to be one of the safest countries in the world to give birth. But that's not for all of us. That's not for all of us. And who believes that allyship can actually support in transforming maternal health care? Please raise your hand. Absolutely. But it has to be true allyship. And that isn't performative. It requires sustained action, uncomfortable conversation, and transference of power. Not just sharing space, but actually giving us the power and the voice to amplify our own voices. Now, today's theme is community-led solutions. They actually do work because they target real lives, real needs, and they respect our diverse perspectives. They utilize our real resources and networks. We need everybody involved in this movement. But we have to have community voices at the table. I personally believe that we should actually own the table, but that's a story for another day. And what happens when black women lead the conversation around black maternal health? We bring our unique lived experiences that no textbooks can teach. We understand the cultural nuances that others might miss. We build trust where institutions have been broken. Thank you so much again for joining us today. We have a room full of just so many wonderful people, including healthcare providers, student midwives, policymakers, researchers, advocates, and most importantly, the community of black mothers coming together. Thank you again. Now let's start. So our first speaker, I am very, very pleased to have 2 wonderful, fantastic women. We are honoured to have with us a national leaders, actually, in midwifery, who brings their extensive experience in maternal healthcare policy and implementation. Please welcome to the stage Kate Brintworth, who is the Chief Midwifery Officer for England and NHS England, and also Wendy Olawile. Thank you. Sorry.
Ladies and gentlemen, Kate is Chief Midwifery Officer with extensive experience across the maternity system. Kate has served as Regional Chief Midwife for London and Head of Maternity Transformation at the Royal College of Midwives. Her special interests include reducing inequalities for staff and service users, system working and helping women make complex care choices. She has participated in national expert reference groups and research steering communities. Please welcome Kate, everybody. And then we have Wendy. Yes, then we have Wendy, who is a registered nurse and practicing midwife with over 2 decades of clinical practice and leadership, appointed as National Maternity Lead for Equality at NHS England in 2021. Wendy is passionate about supporting midwives to provide culturally sensitive care, recipient of British Empire Medal for service during COVID-19, Royal College of Midwives Fellowship, and NHS at 70 Women Leaders Award. She serves on multiple advisory groups and was listed in the WHO UN 100 Outstanding Women Nurse and Midwife Leaders. Please welcome Wendy, everybody.
Good morning, everyone. I was just sat over there and I was thinking, I don't normally feel nervous now when I speak in public, but I feel really nervous today. Why do I feel so nervous? And I thought, because I've never felt more accountable to a group of people in my life The accountability that I hold in a role that has a very big title is really apparent to me every day, and it's one of the reasons why Black maternal health is one of my priorities. It's one of the team's priorities. To be honest, it's the priority. Never has it been more apparent that we need to do things differently. The NHS is reorganised quite frequently. It's something that happens because there is always a drive to make it more efficient and more productive, and for the people working in it, that can feel a little bit wobbly at the moment and a little bit distracting, but actually one thing that remains absolutely fundamental to what we do is the need to tackle inequalities. Everyone who uses maternity services has the right to come in, to be heard, to be taken seriously, to be given the kindness and compassion that they deserve. That should absolutely be the bedrock of maternity care and is what drives me every day. But as Sandra has said, we know that the inequities persist, and it's why we are working through as a national team an equity and equality programme, and we're doing it quite slowly. We are building it because we are building consensus, we're engaging, we're looking at the research, but it is starting to come together. Because one of the things that some of you may know is that there isn't a lot of research to guide our hand. So as a midwife, I sit in a world where evidence-based practice is everything. It is the driving force of most clinicians. They come to work and they want to do the right thing and they use evidence to do it. There is a dearth of evidence. So some of this will be about us building the road as we walk on it, because that is the way we have to try and find out what it is we need to do. How do we tackle these things in a meaningful way? Many of you will be aware of the hope that there was pinned on unconscious bias, for example, and everyone thought that's going to be the answer, that's going to make things better. And in fact, the research said, no, it won't. So we have to be prepared to step into this in a way that might feel a little bit wobbly and uncertain, but absolutely committed to doing what we need to do. And the thing that really strikes me about this is the importance of detail. So the Race Health Observatory, is anyone here from the Race Health Observatory? They are a phenomenal organisation, and they have been piloting an incredible piece of work where they have challenged 9 organisations and given them an area like bleeding in pregnancy or bleeding after you've just had a baby, called postpartum hemorrhage, and said to them, go away and look at this in an anti-racist lens. Go away, unpack your data, unpack everything you're doing, scrutinise everything you're doing and improve it. And Wednesday, sorry, I lose track of the days. On Wednesday, I was privileged to be in the room with some of the trusts who've been working across 4 different clinical areas, and it gives me hope. Their attention to detail, their curiosity, their drive to get under the data, but to use the data to understand their own practice. And what was really, for me, the most important bit was their curiosity and humbleness around what they were doing. No one came up and said, yeah, it's all right, we've got this, we've sorted it all out. They were all saying, well, we've done all these things, but we're not sure which bit is the key driver here that makes a difference. But what we know is that if we come at this through a multitude of angles, we can make a difference. And we saw in the data PPH rates, we call it postpartum hemorrhage PPH, sorry, medical jargon, can't resist it sometimes, coming down and becoming the same for whoever you are in a unit. So there's possibility, there is hope, this can be done, but it is going to take a lot of commitment from a lot of people. And that's why I stand in front of you feeling quite nervous, because I feel very accountable for that. But what I want to say to you is this remains my number 1 priority. And when the Race Health Observatory work, finally we get the evaluation, we are committed to supporting the rollout of that work wider. So I'd just like to finish by saying thank you for all coming together. I think this is one of the most important conferences of the year, if not the most important conference in the calendar. Thank you for coming to bring your energy, your drive, your vision to make it better for the future, because that is what we all need. And of course, a massive thanks to Sandra. What an incredible woman.
Just to echo that, yeah, incredible woman indeed. And thank you very much, Kate, for your leadership in this space. And a very good morning to everyone. And thank you, Sandra and the team, for inviting us. I'm not standing here as a professional or as a national maternity lead for equality, working closely with Kate. I'm also standing here as a Black woman, a Black mother, a Black professional. So it's such an absolutely honor to be here today. And it's my first time here, actually, at this conference. So I'm so much looking forward to the output. So I can tell we all gathered here as professionals, researchers, policymakers, students, mothers, babies. You know, we are all committed to driving change and saving lives. Because of your commitment, that's why you're here. You're not just here by chance. We are here because the data is undeniable and unacceptable. Normally, this is not the way I do my presentation, but I was thinking, how do I address, this audience today? Normally, PowerPoint there, PowerPoint here, showing. I said, no, let's be real. Let's be real. Let's be real today within the 10 minutes that you've allocated to us. So we are not here to rehearse the data. We know the data. We know what those experiences are. We know what the outcomes are. And we know the challenges. So we are not here to tell you about what that data is. So for too long, these disparities have persisted, leaving behind devastated families and communities. And I think Sandra did mention that behind those data are human beings, lives, mothers, parents, sisters, friends. So they're not just data. So their stories, their experiences, and their voices must remain with us and the heart of every decision and initiative, intervention we make. So what's the commitment to change? So in my role, and you've heard from the Chief Midwifery Officer, Kate Brintworth, it is absolutely our priority, and it's not because she's here. She's such an ally in that space. So we are really, truly lucky to have someone that really cares, not just about majority, but minority as well. So I want to make something clear. Equity is not an aspiration. It is a necessity. It is important. The work to close this disparity is not an option. It's not optional at all, nor should it be dependent on advocacy alone. Again, we've heard that every time. It's not just that alone. It must be embedded in our policies, in our education, in our training, in our leadership, and most importantly, in our accountability structure. And I think you've heard that again from Kate. So what does that look like? What does it mean? It means listening to Black mothers and co-designing maternity services that truly meet their needs. I always say to colleagues, when you see that woman in front of you, especially Black mothers, when a woman is pregnant, a community is pregnant. That woman is coming with our whole community. They may not be there, right there with her, but when they go home, the mother-in-law, their own mother, their aunties, we tell them what she needs to eat, how she needs to comport herself. So as healthcare professionals, as a system, we need to bring those values, we need to bring those beliefs into the care that we provide for every woman, so she can be in control and in charge of her care. Tackling systemic biases through mandatory anti-racism and cultural competency, having a workforce that is culturally educated, not culturally trained. They're two different things. And we're already working towards that. Ensuring data transparency so that we track, report, and act on racial disparities in real time. And I always say to people, it's 4 years I've been in this role. And I can confidently tell you, we are not at the beginning of the road at the moment, which is a good news. We are a little bit further into the road, but far, far, far away from where we really want to be. And investing in Black midwives, brown midwives, older midwives, and healthcare professionals so that representation becomes the norm and not the exception. And we all have a role to play. And I'm going to leave you with this word and with this challenge. The responsibility of change does not lie with one organization. It doesn't lie only with the NHS England. It doesn't only lie with neonatal and maternity system and services. It is a collective effort. It lies with everyone in this room. We all have that role to play as a researcher, as a clinician, as a policymaker, community leader, faith leader, mothers. We all have that role to play. Without that, we cannot shift the dial. Black mothers must receive safer, more respectful, and more equitable care. We've echoed that for so many years, but it is also important to appreciate and acknowledge the small processes, the progress that we have made. So this is my call to action as I finish. Today must not be just another conference. Let it be a turning point. Let's move beyond discussion, another conversation. For the promises we make today, and most importantly, let's ensure that when we gather again in the future, Sandra, again next year, we are celebrating progress. Together we can and we must rewrite the narrative of Black maternal health in the UK. Thank you.
Thank you, Kate and Wendy. Because of time, we're going to go straight on to our next keynote speaker. Our next speaker brings valuable political insights on improving maternal health care for all. Please welcome MP Florence Eshalomi.
Florence is a Member of Parliament for Vauxhall and Camberwell Green and Labour MP for Vauxhall and Camberwell Green since 2019. Thank you, Florence.
Good morning, ladies. Okay, who didn't have their porridge? 'Cause that was just so weak. And confess if you had rice and chicken for breakfast as well. Because that's why you're probably tired, right? Good morning, ladies and men. That's much better. It's so great to be with you all here today and to see so many fantastic sisters and brothers in the audience. For those of you who don't know me, I'm Florence Eshalomi. I'm the Member of Parliament for Vauxhall and Camberwell Green. South London, stand up. That's good. And I just want to start by thanking Sandra and everyone at the Motherhood Group for this really fantastic conference. It's so good seeing a safe space for all of us to come together and really address such a key, important issue. The stark reality, as we all know, and as Kate and Wendy highlighted, that Black maternal health story has been persistent for many years, many decades. And we're not moving forward at the pace that we should be. Mortality rates for Black women in 2021 remain similar to those in 2016. And that's even when you take the impacts of the pandemic. And we should be worried about this lack of progress, especially when we look at what previous governments have done on this area, where they had an ambitious target to halve the rates of stillbirths and neonatal births by 2030. And every year that goes by without radical action to address this, this is the stark difference between life and death for Black mothers. Let that sink in. So throughout the course of this today, you are going to hear lots of stats and lots of data and graphs, but I want to focus some of my remarks on the human impact. But it is worth setting out the context and just a reminder of some of those stats. We know that women from Black ethnic backgrounds are 4 times more likely to die during pregnancy in comparison to their white counterparts. We know that women from Asian ethnic backgrounds are twice as likely to die in comparison to white women. And we know that babies of Black ethnicity are more than twice as likely to be stillborn than babies of white ethnicity. And when you take together babies of both Black and Asian ethnicity, they continue to have a higher rate of neonatal mortality than babies of white ethnicity. Now, for many of us in this room, and Sandra highlighted that in her opening remarks, we are so used to hearing this that we're actually at a point of danger of not being angry anymore. But we can't normalize these figures, sisters. We cannot. And we must demand better. We have to demand better. And if we look at the work that the government have done and the NHS, the reality is that they've known about this for so long, and there have been some efforts to try and address this. In 2015, the National Maternity Review assessed the quality of maternity care across the country, and it considered how services should be developed to meet the changing needs of women and babies. It had a clear objective: for maternity services in England to become safer, more personalised, kinder. Why can't you be kind to people? Professional and more family friendly. Its stated aim was to create a health service where every woman can access health, to be able to make their informed choices about their healthcare, and which is centred on their individual needs. We saw action 8 years later, where the 3-year delivery plan in 2023 for maternity and neonatal services outlined how the NHS will deliver against the set objectives in this area. And there were key commitments to workforce expansion and retention, investment in skills, better supports and oversight mechanism for patients, and utilising that key data and technology to tackle health inequalities. So we know what the problems are, and we certainly do not want any more government reviews, right? But the performance against these objectives are not where they need to be. We know that staff recruitment and retention is a challenge in maternity services, particularly after the NHS bursary scheme was discontinued in 2017. I wasn't an MP then, by the way. Recent reports, including the Ockenden Review and the Commons Health and Social Care Committee's inquiry into the safety of maternity services in England, have underscored the persistent, severe staffing shortages in maternity care. Midwives, maternity support workers, and other staff struggling to find time to adequately support new mothers. The situation is particularly worrying in England, where the shortage of midwives stands at an estimated 2,500. And there can be no doubt that the clinical interventions and improvements are needed, and they're part of solving the problem, but they're not the full story. Maternal health inequalities will not be solved without acknowledging that health outcomes are a reflection of wider problems in society. If we look back to the pandemic, there's been considerable national economic challenges over the last few years. I don't know about you, but it's felt like we've gone from one crisis to another, right? And you look at the fact that the cost of living has made things so unsustainable for so many people. And we all know that it is a fact that poverty, poor housing, and insecure employment drive inequalities in health and well-being, including maternal health and well-being. We all know this, but what needs to change? Now, to tackle this problem, we need to talk about the health inequalities and racism within the healthcare. We know that Black mothers are not listened to, and sometimes this is through the unconscious bias and microaggressions. As a result, their symptoms are sometimes downplayed during pregnancy when they should be investigated. And sadly, we know that it's not just in maternity services. I was a carer for my late mother who suffered from sickle cell anemia. I remember many times in A&E fighting with doctors, trying to get them to understand her pain, fighting for them to give her the right pain management. Why are we constantly battling to get the pain we need and the care that we receive? And it pained me that in 2019, Evan Smith died in hospital, a sickle cell sufferer, because he was fighting to get that pain. It's still happening. We have to look at how we address the racism within our healthcare and the dehumanisation of Black women. The Birthrights Charity's inquiry into racial injustice said that throughout modern history, black and brown people have been perceived by white societies as being subhuman. Black women specifically were subjected to forms of health care settings abuse, such as medical experimentation with consistent and forced sterilisation. This is happening, this has happened. And there's a role for government to take. They need to provide leadership in addressing racism. They need to standardise that health data. They need to improve workforce conditions. They need to provide localised care, including the fantastic work that we see happening in the London Borough of Southwark, led by Councillor Evelyn Okoto, where they had their recent maternity commission to review maternity care for women living in Southwark. And they need to listen and empower women. But government is only half of the story. We, as women in charge of our own care, need to facilitate this. We need to make sure we are arguing and pushing back on those assumptions. We need to say no when we know that something is wrong within the gut of our stomach. We need to say that in 2025, we will not be afraid of our own health and go into the doctor. And we will talk to each other when things are going wrong. And this is where the vital role of groups like the Motherhood Group play, in bringing people together to make sure these ideas are shared. So do download the app, make sure you continue to engage in this, and make sure you continue to talk. Don't just come today and take pictures and put it on Twitter. What can you do to make a difference in this? We all have a role to play. I will close by saying that change is possible, but the story of racial equality shows us that the fight is never over. We must come together, redouble our efforts, and make our voices heard for the next generation. And in the words of Angela Davis, I'm no longer accepting the things I cannot change. I'm changing the things I cannot accept. Thank you.
Thank you so much, Florence. That was an amazing speech. Again, due to time, we are going to go on to our next panel session. So our first panel session is on the Black Maternal Mental Health Project, led by the Motherhood Group. This is a research that examines how Black mothers experience mental health support in the UK. We are focused on creating culturally safe spaces, also where women can feel truly heard and listened to. After sharing the findings, we will then listen to the panelists on lived experience. Please welcome to the stage Caroline Bazamba, Angela Ajiboye, and Olympia Amu. Thank you, guys.
Good morning, everyone. It's so wonderful to see you. My name is Caroline Bazambanza, and I'm an anthropologist at the London School of Economics, and I also work with the Motherhood Group, leading research projects, so some of you may have seen me around before. So today I'll be presenting some of the findings from our Black Maternal Mental Health project that you have in the back of your brochures as well. We looked at almost 73 projects of different scales that the Motherhood Group has carried out over the last, what is it, 7 years. And we drew out a focus on mental health from these issues. As an anthropologist, I'm really interested in the way that the social lives of people embed and affect how they perceive their care, and also where they turn to for support. So we really wanted to emphasize the intersection of race, reproduction, and socioeconomic factors in the overall findings. So the findings point to 4 connected themes. These are community and connection, advocacy and voice, education and knowledge, and healthcare transformation that all depend on the construction of safe spaces where mothers can feel heard, seen, and valued. Safe spaces can be material, like this space that we're in right now, but they can also be experienced online or associated with certain institutions and relationships. And I'm sure that this will come out more if you look at the report, the way that those spaces are perceived with institutions. So the first theme, community and connection, was defined by mothers through how women share experience in space to reduce isolation and create solidarity and togetherness. Often, building new connections could feel intimidating and daunting, driven by social anxiety. We found that promoting local events or services drew a clear line between feelings of belonging and positive mental health that was tied to social well-being. First, people tended to turn to digital spaces to search for connection and support with their mental health. However, sometimes these could also exacerbate anxieties, and so we felt it was really important that online spaces made clear signposts to physical and group settings where people can share and find support. In terms of education and knowledge, we sought through workshops, professional development, becoming students, and learning from friends and family how people learn about what their outcomes are likely to be, and also how to navigate services. This was closely linked to the development of advocacy tools, where people feel like they're going to be stereotyped or judged even before they've encountered a service. For women who occupied dual positionalities, those who are both mothers and healthcare professionals, or had friends and relatives who worked in healthcare settings, the knowledge of how to navigate these spaces allowed them to think of strategies to protect their dignity, well-being, and improve their outcomes. But it could also increase fear and anxiety about how you're going to be perceived in the space. We've heard a lot this morning about being listened to, but I think it's really important to also think about how people are seen as before they've even had the opportunity to open their mouths. People learnt about mental health diagnoses through online apps like Facebook, TikTok, Instagram, YouTube, and X, and sometimes this could lead to feelings of uncertainty and fear, particularly in relation to the statistics, many of which we've heard. However, sometimes this also allowed people to build and garner more confidence and know where to go to find support that was tailored to them, first in the community and then perhaps in clinical settings. Women did not feel heard when those providing care were impatient, abrupt, and had little empathy, but they did when they were encouraging, patient, and asked genuine questions about their concerns. Being treated with dignity and respect influenced women's feeling of being able to depend on services and look for help at a later stage. This again embeds the connectedness of all of these systems. If somebody had a negative experience during their pregnancy or childbirth, they were less likely to want to seek perinatal mental health support. Sharing stories with groups of Black women improved women's ability to self-advocate as they learned about how others had navigated difficult circumstances, including racism or being undermined. However, people did not really want to think too much about self-advocacy when they already felt vulnerable. They wanted there to exist community services and clinical services that could advocate on their behalf. Lastly, healthcare transformations were shown to play a pivotal role in shaping Black maternal mental health outcomes. Structural inequalities, cultural biases, systemic racism, and cuts to services all impacted systems from delivering equitable care. Healthcare professionals felt it was difficult to address the interlocking needs of women due to the separation of public services.
Thank you so much for that presentation, Caroline. She's the brains behind all of our research over the last 5 years. I'm just going to go straight on to Angela and Olympia. Just please share your experience of giving birth and any barriers that you might have faced as a mother.
Okay, so hi everyone, good morning. I'm a mother of two, and I had my first daughter, Hope, during COVID-19. As you can imagine, it was a really difficult time. So many Black mums, or every single mum anyway, wasn't afforded the care that we should have been given. When I had my first daughter, it was really difficult because I felt that I had to kind of justify the pain I was feeling. I had to justify and over-explain, my anxiety around, my healthcare. I kind of felt also like I wasn't important when I would go to my appointments. As you can imagine, during that time, you'd have to wear a mask, and I wasn't able to go with my husband. Fast forward to, giving birth, I felt that, the pain that I said I was in, it wasn't taken seriously, it was minimized. I felt like I had to over-explain again, I'm ready to give birth, I know my body, and I think as Black women, don't ever, not think that you're not important, because when I was in that position, I felt like I wasn't important. I felt like I know my body. Just because I'm a first-time mum does not mean I do not know how I'm feeling. Yes, you're a healthcare practitioner, but it's my body and it's my maternal experience. And the thing about having a baby is that you only have one experience. I mean, you may have multiple children, but with that one child, that is your own experience. That's a memory for you. And I felt like I wasn't listened to, even to the point that, I tore, I had stitches. And I felt really, really like, even getting the pain, I was like, I can still feel pain. They were like, we've given you pain relief. I was like, the pain relief is not working. Listen to me. I didn't feel listened to. And then when I was then explaining to my husband, that actually babe, I'm still in pain. They're not listening to me. They were like, just leave your husband alone. Just, you just focus on what you need to do. And it's actually like, no, this is our experience. You need to listen to both of us, especially me. It's my body and I'm a woman and you need to listen to me. Because one thing that I will say is, as a black mother, I'm a human being. And sometimes practitioners or anyone within any institution forgets that we are human beings. When I got to my 6-week checkup, and with my daughter, we didn't come out of COVID till 7 months postpartum. And although I have a lot of family here, I was alone, right? And I remember getting to my 6-week checkup, which I actually called the GP to say, when is the checkup going to be? As you can imagine, there's a lot, obviously, pressures within the healthcare service. But got to my 6-week checkup, and I'm waiting for my appointment, and the doctor had seen the patient before me and had gone over time. So I'm sitting there anxious, like, when you're full-blown anxious, and I was thinking in my head, should I really say how I'm feeling? I'm feeling anxious, but I'm scared to say that I'm anxious because I already know the judgment that comes with saying that I'm anxious. I don't want to look like a weak mother. I don't want to look like a mother that doesn't know what she's doing. And I'm also worried about how you're going to write down what I'm saying to you, because I don't want that to be shared within certain institutions or the work that I do as a professional. I finally got into the appointment, and it was a tick box exercise. How is your daughter? Are you breastfeeding? Tick, tick, tick. No eye contact. You're not looking at me. You're not giving me the attention that I need as a black mother giving birth during COVID-19 or any time. And then finally, what I found difficult was that when it then got to the part about how are you feeling, I said, well, doctor, actually, this is how I'm feeling. And obviously, I'm trying to find my words. And he was like, if you don't mind, can you book another appointment? Guys, my heart dropped. I literally skipped a beat. And to be honest, as a black mother in general, you try to find the words to advocate for yourself, but there's sometimes where you're really knocked down. And I was like, but I really just need 2 more minutes because you went over time in the previous appointment. And he was like, but sorry, you just need to book another appointment. And when it comes to black maternal health, mental health, it's a make or break situation, and that situation broke me. So that was my experience.
Thank you for sharing that, Angela. Thank you so much for sharing that, Angela. I really appreciate you. Just before we go on to Olympia, Caroline, what Angela just shared, does that resonate with the work that we've been doing over the last year? And if so, what really stands out?
Yeah, I mean, that absolutely resonates with all of the themes that we've drawn on, and particularly the ending when you talked about the fact that you didn't want to be in a position where you had to fight to be able to receive the services that you deserve. I think a lot of the mothers that we've spoken to over the last 7 years have been in that situation where they know that in order to actually be taken seriously and have their concerns respected and viewed with dignity, and also individualization and personalization, which, as we know, undergird the NHS's aspirations, but often black mums kind of get wiped out and they don't get seen as individuals. And so, yeah, it very much resonates with the findings that we've seen. Thank you for sharing.
Thank you, Caroline. Olympia, would you like to just share your experience so far?
I have 3 children. I have a 7-year-old and twin girls. So I have my kids really young, so I was kind of new to this anyways. I didn't have a lot of people around me. I was really unfortunate to be diagnosed with a rare blood disorder 5 days after having my son. So I lost my eyesight, I was taken to ICU. It was all very extreme, a lot going on, not really registering what was happening to me at the time. With that, after I had my son, I had like the 6-week checkup, the general sort of things, but no one really checked in to see how I was doing after being told I would lose my life, and then all of these things that I'd never experienced. And I struggled with that, but I had to be a mum, right? I had to go to work.
Yeah.
I didn't want to seem weak as well, so I just continued. And me being crazy, I had twins like a year later. So I'm now like a mother of 3, the age of 24, all of these things going on. And it just I didn't know what was happening. I thought it was very normal to feel anxious because I'm a new mother. I started having like really wild thoughts, if that makes sense. So I would, have a bump on my arm and I would tell myself it's cancer, and I'd be like on the internet for hours and hours, and then I'd be checking my breast every day. Then I'd be doing all of these things, and my kid would get a cold. I would be like, right, she's got COVID, it's going to turn into something else, it's going to happen. And I was just driving myself mad. And I would see healthcare professionals in between, but they would never really ask me direct questions about my mental health. It was, are you depressed? In the last 2 weeks, has your mood been like this? And it's like, it was just never relevant in that time. And I felt like because no one had asked, maybe it was just normal to feel like this. I probably went on for like 3 or 4 years like this, just in absolute hell, I would describe it as, like just within myself and trying to still function. And then one day I just couldn't function. It just got to the point I just could not function. And I'm like a very active person, like my friends will tell you, I'm just a bit crazy, like I'm always doing something. And I was able to get up, take my kids to school, and then I just had to call my manager, and I was just in bed just crying all day. And it was like just too much at that point. I'd convinced myself my mum was going to die. I'd convinced myself my kids were going to get sick. I convinced myself I was going to get that rare cancer that no one else got because I got this rare disease that no one else has. Just a bit of context around that, my disease is like 1 in a million people get it, and it wasn't picked up, and that's a whole nother story. But when I look at my symptoms and stuff throughout my pregnancy, I do think that was negligence as well. I think there were signs that I was sick. I was 60 kilos when I got pregnant, and I ended up 100 and something. I was severely unwell. And when I look back, I'm like, that was very obvious that I was so sick. But I haven't looked into that yet, but that is something that I want to go back and explore and understand. But fast forward to not being able to get out of bed, I called my GP and I just said, look, this is sort of happening. I was quite lucky. He was really good. He said, it sounds to me like you need to talk to someone. He referred me to talking therapy, and I started CBT. But what was great is that there was a form that just was for health anxiety. And it was like, are you experiencing this? It was like, yes. Like, why has no one ever asked me this before? And also, I felt like I let myself down. Why hadn't I spoke up? But I was like, I was scared. Like, I don't feel comfortable when I go into places. I don't feel believed. And similar to what you said, like with my profession and all of these things and having young children, I'm like, are they going to write down that I can't care for my kids? Are they going to try and, like, I was just so scared to just be open and real. But then I did CBT and I'm like a whole new person, and I speak to people about it all the time. And I'm just like, why did I suffer for such a long time, like in silence as well? And you do speak to your friends. It's one of my friends actually, where she was just like, you always just think like the worst of things. And that sort of clicked in my head of, okay, maybe it's not normal what I'm saying. And maybe I need to like check if there's a way of fixing this. And you get tools in CBT, and it's helped me go through my life, and I can share those with people now as well. And I wanted to share this because I thought if there's anyone, even one person in this room who is having these thoughts and they're struggling, there is like help out there. And I think even if you go to one person and they shut you down, go to the next, speak to people, like there can be a difference. But yeah, I could go on all day, but that's...
Before we just go on to one question from the audience, I'm just going to ask Caroline to just, what Olympia spoke about, what themes do you really feel need to be brought to the forefront?
I think this just really underpins the emphasis our report has on community and connection, because it sounds like early intervention could have been so central here, and not necessarily only through the hospitals. They should have taken you much more seriously and listened to your concerns from the start. But it sounds like if you had spaces where you could go to and be surrounded by people who you wouldn't feel judged by, and you shared experience with, that could have alleviated you getting to that rock bottom point where you literally just felt like you were totally burnt out. But it's also fantastic to hear that your GP heard you.
He's one of a kind though, like, because it's not a lot of people's experiences, unfortunately. I felt very fortunate to have that.
Yes, and
He's
also
like my
it's
therapist
great
too.
that the service that you were referred to worked and felt tailored to what you needed at the time. That the fact that they had that health anxiety on the form and you saw yourself in that, I think that's something else that's a lot of people, they don't know really if the diagnosis as it stands is how they're feeling, because they haven't really had the opportunity to untangle the symptoms and how they manifest, because they manifest so differently from person to person.
Thank you. Any questions from the audience before we go on to our next panel? Yes, please. You're sitting down, you're breastfeeding, I think. So,
So
Gemma,
your hand went right up there, so I'll come back to you.
Hi, my name's Annabelle. How did you find the right therapist for you? Because I think that is crucial. One is even going to say, actually, I need help.
Yeah.
And two is finding the right person, which I think can be really, really tricky, especially for black and brown mothers, because they're not always safe spaces. And to open up yourself like that and then be manipulated again, and there's been things in the news about it as well. How did you find the right people to talk to? And the other question, in terms of your profession, how did you kind of navigate that with the stigma of mental health? We already are in we're already up and up a hill battle anyway. Mental health is already a difficult topic for everybody. How did you fight both things? Thank you.
So I'd say in terms of finding the first therapist, I was really scared, like, as you said, of like, oh my gosh, am I going to meet someone? And I actually had like a trainee therapist, which I actually think really helped me. She was similar in age and she was just really patient. I was quite lucky to get someone in the beginning, but I wasn't open in the first session. I was completely like there, like, I don't even know why I did this. And then when she started, she was just speaking to me, but in a way that allowed me to speak. I don't know how to explain it, but I thought she was just going to go there and be like, right, you need to do this, you need to do that. My whole plan of how I cope, I created myself, and she gave me that space. I think you can always change if you get someone you don't like, but I think it's just the openness. She was extremely empathetic from the beginning. Yeah. That was one thing I look for, empathy. I don't care what your qualifications are, like, I don't care if you've done it for 20 years. She was so empathetic from the beginning. And it's quite funny because she had like a voice that I thought was going to be annoying. But by the end, I absolutely loved her. And like, I was so happy. But yeah, I was like, oh God, I don't know how I'm going to talk to this. But it was great. And in terms of my profession, so I'm a senior research nurse and I work within a team who work about improving black health outcomes anyways. And not everyone on the team is black, but everyone is so open to understanding. And I put myself also in a place to sort of shut down stereotypes from the beginning. So I had a really supportive manager who I've been really, really lucky to have. But I guess I can't answer the questions for if it wasn't. But I would say I have had issues at work where I've had to speak up and it's painful and it got me back into mental health issues. But actually I came out the other end. So if anyone wants to speak about that process, of if you have a manager who's trying to try you, I can offer some advice about that too.
What I was going to say as well in terms of speaking like within your workplace, for myself, I actually like personally went through my workplace and looked for counselling. Like, so I work for the local authority and they actually have like a counselling service. So I actually did my own research on the service. I contacted them or asked them questions like, you know, if I share information with you, where does this go? You know, when you write things down, is this only shared with myself? And they'll tell you, you know, it's only shared if they think you're at risk to someone or someone's at risk to yourself. And I also took it one step at a time. The first session, I was like, don't ask me that. I don't want to talk about that. All I want to talk about is this. And the next session, I was like, actually, okay, I'm a bit more comfortable. So I took it day by day. And I also found out how many sessions were available as well, because I think that kind of helps you from the beginning to not kind of set yourself up for failure. Because if you think they're going to be there forever, unless you can pay for it, that's not the case. So you kind of have to know from the beginning what's available to you as well. And just be mindful as well and educating them. So I told them, you know, by the way, my name's Angela. The reason why I feel this way is because I'm a black mum. And this is the reason why I feel, you know, X, Y, Z. So yeah, kind of telling them about yourself helps. Yeah.
Thank you so much, panel, for sharing your insights and experiences. Thank you. Give it a round of applause. Our next panel explores the unique challenges that black mothers face when managing chronic health conditions during pregnancy and beyond. Conditions like cancer, sickle cell disease, and HIV. Please welcome to the stage Nellie, Robert, Gabedo, Liswana, Griffith, and Deborah Anteno.
Nellie is a content creator specialising in beauty, lifestyle and motherhood, a breast cancer survivor with over 650k followers, and she advocates for early detection and better representation of black women in medical research. Then we have Leah Sawana, who is a HIV awareness advocate with over 20 years of lived experience, a mother of 3 HIV-negative children, and an ambassador for Fast Track Cities London. Then we have Deborah, who is a sickle cell advocate, mother of 2 living with sickle cell disease, who uses her platform to demonstrate the challenges of managing chronic conditions while being an intentional mother.
I am amazed and honoured to be here with three amazing, powerful, inspirational women. I won't talk too much. Nelly, please, could you just share your story and your experience? Because I know it's just super powerful.
Hey everyone, I'm Nelly. Just a quick question for you guys. How many of you know that it's possible and you're in fact most likely to be diagnosed with cancer in and around pregnancy? Yeah? Okay, that's good to know because I didn't. And I was diagnosed with stage 1, grade 3 breast cancer 3 months after giving birth to my third child. I have 3 children and 3 of them were under 3. I had my first child in 2020, second in 2022, and third in 2023. I found a lump during my second pregnancy, and I was like, okay, this is odd, and I found it in my breast. And I remember I expressed that to the midwife when she came to do the visit at home, and she said, "Oh, don't worry about it. It's probably just a dried up milk duct." I wasn't breastfeeding, so that's what she said, and it just stopped there. And I chose to believe her because she's the professional. I fell pregnant 2 months after that, almost immediately, and as you can imagine, I've got a new toddler, a newborn, and now I'm pregnant. That lump has absolutely left my mind, and I'm just not even thinking about it. And it wasn't until that third pregnancy I found another lump in my armpit, and that's when my husband and I were like, yeah, something is up. This is not normal. So again, I went on, and after giving birth, I went to my discharge appointment at the GP, and I finally worked up the courage to say something. But prior to that, I was actually going to go on contraception. You can imagine why. I didn't want to do that again. It wasn't going to be 4 under 4. But I remember saying, by the way, I've got a lump. Can we check it out? And she was like, yeah, we need to check that out because this is just hormones. So if it is that, we would not want to feed the cancer with all the hormones that we're about to pump into you with contraception. I was referred 2 weeks later. I had a biopsy, which in itself is horrific and people do not speak about. And then it came back, it was actually cancer. It was stage 1, but grade 3 because it had spread from the breast to the lymph nodes in the armpit. I had a lumpectomy the following month. So I was diagnosed in October, a week after my son's birthday. So I remember feeling somewhat grateful that it was during Breast Cancer Awareness Month because there was like an influx of information, and I didn't feel so baffled as to where to look. And I remember receiving the leaflets and feeling so alone because there weren't any black women in there, there weren't any young black women in there, and there weren't any pregnant women in there. And I remember thinking this type of stuff, like, trust it to just happen to me. And then upon doing my own research, I learned that it was more common than I thought. So I went on, I had chemotherapy 2 days after Christmas. I had my PICC line put in, and 3 days into the new year, started chemotherapy. So that's happening with now 2 toddlers and a newborn. And not to mention, that was the year my husband and I got married, the year that I was diagnosed. So many incredible events happening, but then you have that just destroying it all is what it felt like. And I had chemo for 16 weeks, radiotherapy every single day, and it was horrific. It was really, really bad. And I remember just thinking to myself, there was a point where I was fuming, and it was, the question that I had in my head was, why the F is it that when we go to our midwife appointments, these are not the conversations that we're having? Yeah. Why is it that we don't know that we should look out for lumps, we should look out for changes in the body because we are most likely to, due to estrogen levels being spiked? And in that frustration is where Touchy Feely was born, a community platform where now we spotlight the lives and the experiences of Black cancer patients. And there's just so much. I felt like during treatment, the fact that I was a young mother was disregarded. I think I felt as if they forgot that I had cancer during both pregnancies. So it was almost a one size fits all. And we know that that's just not how it works. And now I completed treatment last year. I am now in my menopause. So part of my treatment is that I am on hormone therapy for the next 10 years. That is to prevent the estrogen levels from spiking again. So I've been catapulted into menopause to manage that. So yeah, no more babies, but I'll be okay.
Thank you so much, Nelly, for sharing your experience and your story. You're incredibly brave. I'm going to give everyone a chance to ask questions after we listen to Liswana. Thank you.
Thank you. My name's Liswana Griffiths. I'm a Black British-born Caribbean. I found out that I had HIV when I was pregnant with my second child. That experience was terrible. I had amazing care. The midwives were amazing, up until I went and had a cesarean. So I was told I wasn't allowed to breastfeed. The best way to have the baby at that time was to have a cesarean. I could have had a natural birth. Just in my mind, I just wanted to make sure that my child was safe. So I did what the healthcare professionals told me to. So I had my cesarean. I was with my sister. She was my carer, partner, birthing partner. And they put me in a side room. And up until they put me in that room, the care was 10-10. As soon as I went into the side room, I did not see another human being. And my sister went home to have a shower, get changed, and bring some stuff. I've got a newborn baby in a sliding crib that I can't get to. I've had a cesarean, so I've got an IV drip, I've got a catheter, and pain relief. I've got a baby that's crying. I'm pressing the buzzer. No one's coming. I am unable to get to my phone. I'm unable to get to my child. Until my sister turned up hours later, I had no care. I felt like there was a warning sign on my door. I felt like I was just disregarded. So as soon as the midwife decided to come in, because the family member was there, I asked, can I be discharged? But in between all this time, my cousin was also pregnant at the same time, and she had called all the hospitals and found out what hospital I was in, and decided to come up and visit me. So I asked very kindly, do not inform my family that I have HIV or anything to do with my baby. A midwife walked in while my family members are there, and they did come with loads of them. I think there was about 10 members. The midwife walked in and said, look, we have to take the baby to give them the medicine. And my family member asked, what's the medicine for? She goes, you know what it's for. And she left. I go, discharge me now. Within 24 hours, I left that hospital. I needed a blood transfusion. I said I'd rather go home and look after myself, because if I'm gonna die, I'd rather do it at home with my family than here with you. So they discharged me. I was fine. My child was fine. Let's fast forward to 2021. I think this is gonna be different. A surprise baby, by the way. This is going to be totally different. I've worked so hard to make sure that people living with HIV do not get discriminated against, that we have the best care. And I do. I have really good care. My checks are on point. So I go for my first midwife appointment. I'm informed that the midwife I was meant to be seeing was sick, so another lady was picking me up. I said, fine, it's COVID times. So she's sitting on one side of the room, I'm sitting on the other side of the room. The initial first appointment can take up to 2 hours. So we've gone through nearly everything. We've got to the last bit, and she asked, would you like to opt out of blood-borne virus testing? I said, no, I'll do them all. but I already know my status for HIV. She turned, she looked at me, she said, I'll be back. She left the room and she spoke to 3 different colleagues outside the door saying, I don't know how to deal with this woman. The consensus after she spoke to all these people was she came back into the room, she said, I'm going to cancel this appointment. You need to see the midwife that you were originally seeing because I can't deal with someone like you. You're meant to see a specialist because people who take drugs and other things like that need to be with a specialist midwife. Let's be clear, I counted to 50. I'm very opinionated, I am very outspoken, and I thought, she does not know who she's messing with. Because if I was a person who had never been in the community, didn't know my rights, who wasn't advocate for other women, I would have left that hospital and 2 people would have been at risk, my child and myself, because I would never have come back. I got up, I left the room, my poor partner, bless his heart, got it. I was angry. But I wasn't angry because I wanted her sacked. I wasn't angry because I wanted her to be day-texted and strung up or anything like that. I was angry that this was still happening 20 years later. I work with an organisation called 4M. It's maternity health for women living with HIV. I also do as much as I can to make sure that women, black women, get the care they should. So I finally got to see my original midwife and my consultant. And I said, I would like this midwife to not be penalised. I would like her to be trained. I don't want this to ever happen to another person. And that's how we should work. Unless they do something that will put my life or that child's life in danger, don't try to get them sacked, get them educated. Knowledge is power. So I asked for her to be day-texted because she shouldn't do this to anybody else. But I also said, I will come back and train her. I'm happy to train the whole of the staff. And what makes it worse is, I work for that organisation. I work for that NHS trust. They still haven't done anything, but I have done a programme. It's called HIV Charter. It's a stamp of approval to say that you are HIV friendly. So if this charter is there, people living with HIV know it's a friendly, safe space for them to share their status with you. And it's not disclosed, it's share. I'm sharing a piece of myself with you. And I had my baby. Luckily, she was born lovely. She's 3 years old now. But 6 weeks after her birth, 5 weeks, sorry, my partner died. He dropped dead in the kitchen while preparing breakfast for his other children, my spares. And I had 2 breast pumps on, and I'm doing CPR, but he did die. He had high blood pressure, and because I was pregnant, I was taking care of myself and not catering to his needs and making sure he took his pills every day. This is where I needed mental health support, and I knew this. So I took my sister to be my emotional support sister, and she was stuck by my side for the next 2 weeks. And I asked my healthcare team to give me mental health support. And I know it was COVID, but every time that I was engaging with the mental health section of the hospital, they saw me dressed like this, my hair done, my makeup, my kid looking fine. And they're like, are you sure that you actually need support? The only reason that I survived is because of the HIV community. My sisters gathered round me and made sure that I had food, that I ate, that I drank, that I was looked after. Community is all. And I will say thank you to anybody and everybody who supports another woman who needs support. The HIV wasn't an issue. It was the fact that I'd just given birth and I needed support. And it was missed because I looked a certain way.
Thank you so much, Lisa Wana, for sharing that.
Thank you, Deborah. Hi, my name's Deborah. I suffer from sickle cell. I am a mother of 2. My story is a bit different because I was born with sickle cell, and I already know how it feels to not be listened to. Like, there's been several years of me going to the hospital and saying I'm in pain, and they will look at you and be like, are you sure you're in pain? Or, oh, you're scrolling on your phone, are you sure you're in pain? Or they'll give you painkiller and tell you, we've just given you painkiller, so you still can't be in pain. So when I was pregnant, I had my first daughter at 32 weeks. I had a C-section. She was premature. There was not enough fluid going to her head, so I had to have a C-section. Had the C-section now. 2 days later, I can't feel my legs from waist down. And I'm telling my doctors, I'm telling my nurses, like, I can't feel my legs. One of my sickle cell nurses actually came to me and said, oh, you're being lazy, Deb. Just, you know, it's because you've had a C-section. Just try and get up and walk. Every time I would get up and walk, I would fall straight, like I would drop. I had my mum there with me all the time, and that's the only thing that saved me because I don't know how I done it. Every time I would try and walk, I would fall down. My doctors took so long to listen to what I was actually saying. They were pinching me, using hammers to hammer my knees. Like, they just didn't believe me. They just didn't see how that was possible. So I had blood tests and stuff, and it came back that I had Guillain-Barré syndrome, which is something to do with your nerves. A lot of people get it through C-sections in pregnancy. You can't feel your body from waist down. So I've had a newborn baby. I can't walk, and I'm scared. Like, I'm thinking, what's going on? I can handle the sickle cell. I've lived with that my whole life now. But this new thing, I just thought, what is happening? What am I going to do? I just went into a complete shutdown mode where I cried so much. I wasn't able to look after my child, and I was stuck in the hospital for like 3 months. At a point, I had to get a mental health nurse that would come and see me every day because I cried so much. It wasn't making sense, and I wasn't getting the support I needed. I feel like my doctors also didn't know what was happening, so because they didn't know, they couldn't support me because they're used to the sickle cell side of things, but when it came to this, it was all new to them, so they were tossing me here and there. This doctor will come see me, this doctor's like, they don't know what to do, this doctor. So it's like, everybody's baffled. So my only thing that saved me is my faith, if I'm honest, because, like I said, no one could help me, no one could tell me what was going on. So it's just, imagine, I've just had a baby, already dealing with sickle cell, can't walk, and nobody can explain it. So I just held on to my faith. And one thing I always say is that know how to advocate for yourself, and always have someone that is there that is able to advocate for you, because at that point I couldn't speak for myself. I was so lost and so broken that if it wasn't for my mum that was there, that was advocating for me, I don't know what would have happened to me. That's why I find it so important. I like to advocate for young females now who are pregnant or who are going through that stage, because if you don't have someone that is able to speak for you, these healthcare professionals, some of them are vile. Some of them are vile, honestly. They do not have the heart for the job. That's how I feel. So, really, that was it.
Thank you so much. Can we give a round of applause for Deborah, Melly, and Suwana? We'll just take two quick questions. Just raise your hand.
Any questions for this panel? Sorry, amazing panel, can I just say?
Yes.
I didn't know that I was going to need tissues for this section. Could have had a warning for that. Any questions? Okay, we have one. Two quick questions so we don't run over. Can you say your name and who you are or what organisation you're from?
Hi, my name's Butchie.
Yeah.
Hi, ladies. My name's Butchie. I'm first a black mother. Secondly, I'm a black female GP. Have been on for almost 2 decades. But I want to say to you ladies, thank you so much for sharing your stories, because my birthing story was horrendous. I'm someone who's a medical professional who did ONG back in her junior years, and I still had to advocate. And it makes me really angry that in 2022, when I had mine, I'm still hearing stories which are matching people decades before me. And it's so, it really frustrates me that at the time we're most vulnerable, we're still having to fight. So we're having to feed into that angry woman trope because people are just not taking us seriously. And I just want to say to all of you ladies, look, if you ever have a medical issue and you're really worried, please keep on talking and representing yourself back to the doctors. Find someone who will listen to you. Find someone who will actually care about you. There are. Trust me. We are here. We may not be many, but we are here and we will listen. But don't give up. And just like what Deborah said, if you cannot advocate for yourself, please find someone who can. My mum was my biggest advocate. She's a retired midwife, and she made sure that I was safe. Because even though I knew what was going on was rubbish, I couldn't at that time speak for myself. And I kick myself down and I look back at it because I think, I'm an intelligent woman, why couldn't I talk up? But sometimes when you're most vulnerable, you just can't speak. And you're worried about how people would then treat you if you were to speak up. So please, ladies, I don't actually have a question because actually I'm shaking because I'm still angry. At least even listen to you guys, making me angry still. But I'm just saying, please, 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 please keep talking to medical people. Get yourself seen to. If you have an issue, find that doctor who cares, please. Yeah.
Thank you. Yeah, thank you so much. If we have no more questions, we have one more. Okay.
There is one.
Okay.
I'm Marina, I'm a midwife. I just want to, just one sentence, document it. Please document that conversation we've just had, because your medical records are going to show our medical perspective as what's happened. So if you say to them, document that discussion, document that I've told you about that lump, document it, then it makes them stop as the midwife or the doctor and just say, oh, actually, what am I documenting? Because that's at least then something that might slow them down and take someone with you every time you have an appointment.
Thank you so much to our wonderful, inspirational panelists. Thank you, Nelly, Lisawana, and Deborah.
Watch me trip down the stairs.
Our next speaker will show how representation in maternal health care must address racist structures affecting black mothers. Please welcome to the stage Aisha Thomas.
Aisha is the founder of Representation Matters Limited, focused on anti-racist practice and equality in education. A former assistant principal, Aisha presented a BBC documentary, gave a TEDx talk, and recently her debut book, Becoming an Anti-Racist Educator, in 2022.
I wanted to start by saying thank you to you, Sandra. There is something very special about walking into a space and just being able to breathe. Just being like, no code switching, no assimilating, no bracing. We just get to be. I didn't have to do my normal ritual, which is I tend to kind of zip myself up before I go and talk. I haven't done that today because I feel like I can be authentically me. But that isn't by accident. You have cultivated a space that centers us, centers black women and our experiences. The energy is beautiful. The lineup is fire. So I just need to start off by saying thank you. All right, so I have a bit of a confession. I struggled to do this. I really struggled to write this talk. Not because I don't know how to speak, I talk all the time, but because I wanted to do it justice, because this talk is for us. It feels like a little bit different. So I wanted to share a case study about a 22-year-old black woman. But first, a little bit of a trigger warning, because it could be emotionally activating. So it was a Sunday morning. She woke up in excruciating pain. She had blood everywhere. It was down her legs, it was across the floor, and she didn't know what to do. She was crying in pain and she rang her mum, who urged her to go to A&E. She sat there for hours and hours just waiting to be seen. Eventually, she was asked to do a urine test and had her bloods taken. A doctor arrived and asked, "Are you pregnant?" She said, "No." The nurse responded and said, "Well, you are, but you just had a miscarriage." She was shocked, mortified. She didn't even know she was pregnant. And now she'd lost a baby in the same moment. She was given some tablets and she was told, "Take these to ensure that you get it all out." And then she was sent home. She called her mum, who immediately told her, "Don't you dare take those tablets. Go to the maternity unit. This isn't right." So she made her way there. After an examination, the doctor explained, "There is a fetus, but we cannot detect a heartbeat. You'll need to have a D&C to remove the remains. Can you please come back in 10 days for your procedure?" When she returned, she was examined again. This time, the doctor said, "Oh, there is a heartbeat." So she was confused because they told her the baby was gone. "Nope, the fetus has a heartbeat. What do you want to do?" She decided that she would go ahead and have the baby. After all, it'd been through so much to survive. 9 months later, as she began to feel contractions, she went to the hospital, but she was sent home. "It's too early. Come back when you're further along," they told her. So she returned home, in pain, but thought it was the best thing to do. But she went to the toilet and she saw some light pink streaks and thought, "No, I can't wait," she said. This time, I needed to go back. So she desperately wanted pain relief and decided to go back. As she got to the hospital, she was examined again, and they said, "This time, we're going to admit you." Her mum recalls that she was visibly distressed and kept shouting, "Do not kill me like you killed the woman on the TV." That fear is not irrational. It is inherited. It is learned and it is lived. How many of us have been dismissed, unheard, and gaslit in moments when we are the most vulnerable? We already know the stats. So what do they mean for us? Many of us here have a story, our own or someone else close to us. We know that the risk isn't just numbers, it's lived reality. But these outcomes are not about individual bodies failing, but about a system designed to ignore and devalue Black women's pain and autonomy. But why should we have to fight for basic care? We're always told to advocate for ourselves, but why is survival dependent on us having to fight? A safe, dignified birthing experience is not a privilege. It is a right. A right we should not have to fight for. Anti-racism means the system changes, not just that we become stronger within a broken system. It means that every midwife, doctor and policymaker has a responsibility to decenter whiteness
She sent a text
in care.
message and
But
said
this doesn't just
that,
extend
this was
to
about
white folk.
25 past 11.
We have to be all the way
meeting's
real
running late.
in this
It's not going to start
conversation.
until another 5 minutes.
Because we know skin folk ain't always kinfolk. Anti-racism isn't just for white professionals. We must unlearn our internal biases.
And it's
too.
1:45 now, more or less.
It means shifting from inclusion, let us in, to ownership,
10 minutes meeting.
redesigning
Which
the
meetings
care
last for 10
that
minutes
we
anyway?
need. It means connecting to ancestral teachings and being guided by our collective consciousness. We need to be
very
able
nice,
to see
Auntie.
it, interpret it as a problem,
So why'd she come then?
feel responsible,
because she's got nowhere
and
else to
then
go.
take action.
Nicole, can you go on mute?
When talking about the knowledge gained in this space, I use the analogy of money. I posed the question, how do you spend your
You're
anti-racist
scared that she might be just around the
currency?
corner.
Is it just storing in your account, gaining a little bit of interest, telling the odd friend and family member about what you know?
Why did you
Or
go
are
to
you
grandma?
investing, really having a good risk tolerance
Hi,
and
Nicole.
truly
I think
taking
you need to
strides?
mute your mic, Nicole.
Now, my company is called Representation Matters, so I know it's important, but it isn't the end of the story. It's not just enough to see ourselves in the room. We need black midwives and doctors, yes, but we also need them to be empowered, not silenced, and not forced to conform. I worked with a black midwife who told me when she was in the labour room with a white patient, she was asked to leave. The mother didn't want a black woman delivering her baby, but not just leave the room, leave the ward. Go take 5. Now, on paper, there was diversity, but the space wasn't ready for her. Representation matters, but it wasn't enough to stop the racism. Representation without anti-racism failed her, leaving her feeling powerless. But representation with power, that changes everything. A black doctor once challenged why a black mother was being referred to a psychiatric ward. The reason, she was tapping her head. That was all it took. You know what I mean. Now, the black doctor interjected and said, "Is she black? And was she doing this?" Yeah. Well, that's how some of us scratch our heads. Oh, well, I guess I better reverse that psych consult then. Representation mattered, it made a difference. The cultural competency and the cross-cultural literacy are vital for all. We deserve better, and we're already building it. We are already doing this work. Doulas, community birth workers, black-led advocacy. We are the revolution we've been waiting for. I am very blessed because I work with a wonderful collaborative team in the Southwest called Black Maternity Matters. And we are making strides to educate clinical and non-clinical staff. They're in the room over there. Shout, ladies, you're there, you're there, you're there. We are gaining a clinical mass of anti-racist perinatal staff and leaders. The statistics in the region are shifting because we are shifting them. We are building a future where survival isn't the goal. Joy, dignity, and autonomy are. So the question isn't, how do we survive the system? It's how do we make sure it no longer has the power to fail us? Because the story I told at the start, that wasn't just a case study. That was me. My son, he is now 17. He is almost an adult and he's studying for his A-levels, preparing for his driving test. But more than anything, he's still alive. Just a few days ago, I practiced my speech with him and we were having a conversation. And then he said, "Grandma, thank you for saving my life. At least you never gave up on me." Thank you for listening.
Thank you so much. Oh, thanks. What a wonderful speaker she is, isn't she? Aisha's just amazing. And our final panel before we go on our lunch break, yes, we do have some warm lunch. You know we like hot food out here. No rice and chicken, but no, actually, there might be rice and chicken, yeah. No sandwiches. Right. No shade, no shade. Our next panel is called Transforming Maternal Care, Meeting Black Women's Needs. This panel explores how to redesign maternal services around Black women's experiences. We'll discuss new approaches of mental health support, education, community programs. Please welcome to the stage Dr. Stacey Moore and Tope Medupin.
Stacey is a chartered psychologist, clinical supervisor and mother of two. Dr. Moore brings authentic audience connection as a speaker, blending psychological expertise with wellness. And also Tope is an operations leader with over 14 years of experience in finance operations across the UK and US. She focuses on creating inclusive, equitable work environments as it's partnered with senior leadership teams across multiple sectors.
Fantastic. Even though you guys are seeing Stacey here as a panelist, I know her very well. She's been working with the Motherhood Group for, I think, 5 years now on our training program. So she knows very well how to, redesign maternal experiences. Can you just share a bit about what we've learned or shared so far and your experiences of how services can meet our need and redesign according to us?
Yeah, so one of the themes that comes out very, very loud from the training that we do together, Sandra, I'm just going to go slightly. Well done for today. I'm sorry. Seriously. You've done it again. One of the things that comes out very, very loud from the training that we deliver, as well as the work that I do, is the importance of community involvement. And it's not being done to, but again, being listened to and understood how it is that we need to meet our needs. One of the findings from some of the research that I did, as part of my doctoral research, I looked at undertaking a systematic literature review around some of the things that were working, because I was very tired of every time we looked at how do we redesign things. We go into how are things not working?
Yeah.
What's not working? This is really bad. It's like we know it's bad, but surely over the years there are things that are good that are actually working. So we're not a monolith. We know this already. There are so many different factors that might impact on us. So community examples such as, there was an example such as the Sweet Mother group, which looked at women from West African communities coming together, and food was very important in ensuring that people felt able to build trust and share information. Another example for a South Asian community who their status was questionable, and it was how do we ensure that we keep repeating the understanding of your legal status is not important here, even though you are looking at us as it was a local authority intervention. We're not going to be passing that information on to anybody. Our priority here is you and how you're connecting with your babies and with each other. Some other example, there are so many examples of where people are getting it right, and the crux of it is when people are really listened to and leaned into. And I'll end with one final example of how we might say, okay, well, all of these disparities, is it to do with financial implications, social implications, the fact that we're more likely to be from lower socioeconomic groups. And one of the bodies of research I looked at noticed that those women who are from higher income brackets, the idea of stigma was very, very strong. And if we were going to do anything to make it more likely for people to access mental health support, we needed to impact on the friends and family groups of those women. The difference in stigma was in general, public stigma is really loud, but for the group of women, black women from higher socioeconomic groups, we were looking that they were more susceptible to the stigma from their smaller within networks. So that's where we need to kind of shift the narratives, shift the understanding of stuff.
Brilliant. Thank you so much for answering that. Tope, I know you represent NCT, an amazing charity who we're currently collaborating with. So just based on your experience and what we've learned so far, what role do you see collaboration in terms of how we can meet the needs of black mothers?
Thank you for today, inviting me on the panel. I think listening is at its core, and I think somebody said earlier about that balance of power and where you then share it, how you distribute it. I think being able to distribute that power means that people are able to create the spaces, the services that actually meet their needs, and being able to, working for an organisation like NCT, we want to ensure that what we do, our services, our courses, that they meet the needs of all women, and that regardless of who you are held and supported by the practitioners, by the volunteers, by the peer supporters that you're interacting with. But also there's so much power in creating spaces that are specifically for you, and how do we as an organisation collaborate and support organisations across the UK to be able to do that. At Entity we have initiatives like our initiative in New Nurture that supports women who are seeking asylum or have migrant status, and actually just that time and care to be able to listen and actually meet them where they are. And we talk about that self-advocacy, but if you're not able to, how do the people that you're seeking support from advocate for you? And I think being able to use co-creation, co-collaboration to be able to create those services are so important. Again, designing with, not for. And so I think that's really important as larger organisations, the sector really understand how they hold power, but also how they distribute that to make sure that the services in the community are relevant, are safe, are competent.
Thank you so much, Shoppe, for sharing that as well. I'm going to ask another question before we open it up to you amazing people. Stacey, Tope spoke about collaboration, co-design, co-creation. We know that sometimes it can feel quite tick-boxy, quite disingenuous. I know that firsthand because we often get hundreds of emails daily. You know, the Motherhood Group, can we collaborate with you? But essentially it's just about accessing our pool of black mothers. That's what I do. When I open up the emails, I roll my eyes. But, you know, some genuinely want to work with us to genuinely support black mothers. One, how can we tell the difference between disingenuous collaboration and the real ones? And two, how can they create, if they have, you know, good intentions, but, you know, their entire team doesn't represent us, they don't really, never taken an interest, but they do want to start from now, what can they do?
Yeah.
So 2 questions in one, essentially.
Okay, first of all, I think, and this might be a bit of a controversial response, we've got so many more important things to worry about to start thinking who is disingenuous and who is kind of authentically leaning in. The fact that they are contacting you, and you expertly do this anyway, turn it to your advantage. You've lent in. Clearly there is something you want to do.
Yeah.
So when we are responding, even if it is disingenuous, we're not going to respond and say, well, you can do an afternoon training, off you go, you can tick your box, wonderful. That's not the commitment that we're looking for. The commitment that we're looking for that will actually lead to change is not only the training of your staff, upskilling. And somebody said earlier, it's education as opposed to, you know, training. You need to educate. And by educate, that includes a real element of self-reflection and understanding, not just on an individual basis, but on a systemic basis too. So I work with another wonderful psychologist called Dr. Shungu, who talks about something called the 6 stages framework. And I'm doing some work in other areas where you can understand where you are in the scale of being anti-racist, but not to get stuck at that conversation of, you're racist, no, I'm not, you're racist, no, I'm not. That, again, irrelevant conversation. I think this comes out sometimes when women are accusing services of being racist or showing practices that were not helpful for them. It gets into this dichotomy of, we weren't racist, yes you were, and it's that we get stuck at that. We need to unpack, this was experienced to me as unhelpful or racist, and therefore what we need to do to repair that is X, Y, we broaden the conversation. So just to briefly summarise that answer to that question, it matters not how they come to you, but I suppose the responsibility is to push back to them. This is the answer. It's a systemic answer, not a quick fix. And part of that systemic answer is committing to over time, because we all have team meetings, right? Every service has team. Oh, what's on the agenda today? The commitment should be, as part of that agenda, there being reflective supervision spaces for those practitioners to come together and over time challenge the way that they are responding, not to just things in the post-training, but every month, ad infinitum, where that commitment has to be there. Not just for one, but for all. Yes, I love that.
2 very quick questions. Gemma, one
Do you want-
behind you,
I'll
and
sit
then
you
one
right
on that
behind me.
side because they've been ignored a little bit and they've been like.
Hi, my name is Makalonge. Really great panel, really great day, Sandra, thank you. Aisha mentioned it before in terms of the role that ownership plays, and I guess I wanted to slightly challenge your answer there, Dr. Stacey, in terms of the disingenuous nature that organisations can engage, because I feel like actually there's a danger there that they feel that they've ticked the box when nothing's really changed. So I wanted to kind of push you on that response and ask for your view and the role that ownership plays in the wider landscape. Because I think the power dynamic is really important.
Yeah, it is.
Thank you. Good question.
Yeah, thank you. Just to expand on that, I think it's not that it doesn't matter, because of course it does. It does matter. There are organisations that will approach the Motherhood Group and other organisations. But I think the way that we push back is not leaning into that narrative of, yeah, we'll tick the box for you. Yeah, just throw some money at it and we'll be fine. If we're coming back to you, we're contracting with you that this is the expectation that you are going to do the work. We expect you to engage meaningfully with it's the terms and conditions in which you engage when you push back. And it's the expectation that the community will be involved in this. It's the expectation that it's over time. And so I think at that point, you'll filter out the ones that were only doing it because they were, we're going to tick the box and not. And I suppose that comes to your point that maybe when you push back and say there is an expectation for you to do the work, those ones that were disingenuous would just peter out. So at that point, we need to have that other mechanism of, okay, well, you approached us. So, how do we push back and say, well, you didn't engage, well, what is it you're doing next? Especially when there are larger organisations such as NHS trusts. And I think with the experience that I've had with Sandra is that I hope there are some of the NHS trusts that we've worked with here. Are you here?
Yeah.
If we've done the training with you, there's quite a few of you here. Yeah. So perhaps when you came to us or to the Motherhood Group and asked the question for help, it might not have been, there wasn't an understanding of the level of work you had to do, and that commitment maybe was not there. But I would like to think that when trusts are being measured, so the outcome measures from other organisations within education, it would be Ofsted, within health, what would it be? Clinic, yeah, so CDC coming to you. There needs to be checks and balances within those methodologies of looking at quality care as well. So we can only do so much, but when systemically above them, when they are being asked questions of what have you done to meet these needs that have been highlighted, they're being held to account. So I think it's good that people are contacting the Motherhood Group and us as organisations, but we also need to rely on the bodies above to hold people to account to the standards that we are setting as good enough.
Good question. Thank you. And then the last question there.
Oh, you went up first, so I'm going to come to you. Could you pass it along? I'm going to start here next time, guys. I'm not going to.
Hi, my name's Layla. I just want to quickly say that you're all heroes. I'm so glad my sister invited me today, and for everyone that is going to speak and has spoken, the fact you've turned what happened to you into positive action, we're so grateful. But my question is to Dr. Moore. How much do you think, and it follows on from something you said, how much do you think class affects the experiences of black maternal health care? I find when it comes to ethnic minorities, class doesn't get spoken about as much. We might say, for example, white working class boys are underperforming, but it's always the black community. We don't often give any kind of qualifications. I'd love to know if you find that, how that intersects with race.
Yeah, that's an amazing question. It certainly does. So to simply answer your question, yes, it does. You're absolutely right, and it is overlooked. I think, unfortunately, even when we look at the research, I'm sure Dr. Caroline can also talk to this as well. Where are you, Caroline? Okay. But even when we account and when we're looking at research and we control for socioeconomic status, the outcomes are still very dire for us. So, you can't explain these difficulties away by saying, well, it's because you're poor. It's like, well, you might still go into, I've got my own stories as a mum of two, having had 3 pregnancies, 2 were successful, and the experience of my first birth of, because you can see you're a black woman, I realise now this is probably why it was, that there was a blanket statement at one point that we need to perhaps progress black women's deliveries quicker. So I was offered a sweep. I didn't want a sweep. It wasn't the due date yet, but I was offered a sweep. And then there was the coercive control into, well, if you don't do this, what may happen? And actually the onus is then on you. And this is somebody from, you know, my background is working class, but I have an education now. I've got, you know, I work as a professional. But I'm still experiencing this same treatment. And that delivery ended up being absolutely horrendous. Emergency C-section with a midwife who didn't give me sufficient painkillers. It was horrendous. So even with the addressing socioeconomic status, the disparities are still dire. So although we haven't spoken about class, I think it's unfortunate. The reason we haven't spoken about class is that it doesn't actually make any difference. Yeah. And that's the frustration, that even if you think, well, your parents have done the right thing, you've done it. I know NCT tends to be quite seen as a middle class organisation, so I wonder if it would be helpful for Toby to come in on that question as well.
Yeah, it's interesting because we spoke about the fact that we both have a bit closer. We both did do NCT as we prepared to have our first babies, and I think absolutely there is from my personal experience, regardless of how educated I thought I was or how strongly I thought I could advocate for myself. Actually, both of my pregnancies were actually quite uneventful, and despite having to navigate the unexpectedness of birth, my outcomes were no major events. But what really overshadowed it was, in all of my appointments, it was the perception that I would be, or the anticipation that I would be perceived a certain way. So that I had to make sure that I was armed myself, that I wore my hair a certain way. I would never dress in a tracksuit. I would never, I would talk articulately, because I knew that those were the markers of respectability that meant that I would be taken seriously in that room. So when I had to, and where I should have been absolutely solely focused on myself and my baby, I wasn't. I was thinking about, how will I be perceived? How will what I say, will I be listened to? And regardless of my socio-economic background, that was still the weight that I carried through my appointments and through my birth experience and through the other end as well. So it doesn't matter.
It doesn't matter. And just to echo what they both said, many of you guys know I gave birth last year, about a month before our conference, and my third experience wasn't good either. And that's after 7 years of advocacy, campaigning, conferences, writing books, because I came in with my wig off and my tracksuit. How
dare you?
How dare I?
Dare you? Dare you?
I was made to wait 6 days to be induced after my baby had reduced fetal movement, and I wasn't given a room. And when I realised, oh my goodness, I might look different, I had to put on my, ask my husband to go and get my wig from home. Bring my makeup. That's exactly what, and the shift, if you know the shift, somebody called me a Love Island babe, and that's when I noticed the shift. And then they came into the room and gave me a nice room. Somebody noticed my name on the board, came in, and she came to the conference last year, and then I saw the attitudes change. So it doesn't matter. It doesn't matter. Thank you guys for this wonderful panel.